Hello, everyone. I'm Chris Ruhm with the Ruhm-Insurance Agency. I'm a licensed independent insurance agent located in Cincinnati, Ohio. I currently am licensed in 15 states and I represent a bunch of different carriers. Today, we're going to be talking about Medicare Advantage plans with prescription drug coverage and Medicare Supplement High Deductible G, sometimes referred to as Medigap plans, because Medigap plans cover the gaps that original Medicare does not cover. Here you'll see my contact information. You can reach me by phone, email, or you can visit my website. On my website, I do have a few helpful tools. I have a Medicare page that will go into some more of the details that we're discussing today. I also have a blog that goes over a lot of different plans that I've done blogs on in the past. And I have a get a quote page. So if there's anything of interest and you'd like a quote, I have some really easy forms that you can fill out and it comes right to my email and I usually send a quote within 24 hours. So again, with either of these plans, they work with original Medicare, and that's what I'm going to discuss next. Now I'm going to discuss original Medicare in its basics. There is more details than what I'm going to go over today. I want to keep this simple and not run it too long. So there are 4 parts to original Medicare. Parts A, B, D, and C. I skipped over C on purpose. So Part A is hospital, Part B is doctors, Part D is prescription. If you combine those 3 together, you can get a Medicare Advantage plan with prescription drug coverage, and that's what we're going to be talking about today. You must have parts A and B to get an Advantage plan, a Medicare supplement, or a prescription drug plan. So both of those have to be in place in order to get one of these plans that we're discussing today. Most Americans will pay $170.10 for their Part B. There is an income-related adjustment for higher earners. There's also a way to appeal if 2 years prior you are making a lot more money than you are now in retirement. And I do have a blog called Income Related Monthly Adjustment on my website. So if that's you possibly, you're paying more than the 170.10, I encourage you to go check out that blog I did or reach out to me. Part A is free. That's what we've been paying into all our life. So if you've ever received a paycheck, which I'm assuming most of us have, if you saw that Medicare deduction, that's the deduction for Part A. The most important thing to realize is you never lose original Medicare with an Advantage plan or a supplement, but they do work differently together. If you decide to go with a Medicare Advantage plan with prescription drug coverage, this is how original Medicare works with it. Medicare contracts with an insurance company. Medicare pays the insurance company a set dollar value for each enrolled member in the MAPD plan. And they have a different amount that they provide based on service areas. The Medicare Advantage plan must cover everything original Medicare covers. They cannot cut out any part of original Medicare. So that's the important note. Insurance companies will design plans to be competitive in the service area they are providing coverage. And what we notice is the more money they give per member, the plans are a little bit richer in that particular service area. You will carry one ID card for all your needs with you do not need your original Medicare card anymore. So that red, white, and blue card, you don't want to get rid of it, obviously, but you can put it in a safe place until you need it again. If you decide you want a Medicare supplement or a Medigap plan, such as high deductible G, it's really simple. You do carry your red, white, and blue card around with you, and you hand that to the doctor, the hospital, or the facility you're visiting, and that pays first. You have on this particular plan, Medicare Supplement High Deductible G, you have original Medicare until the high deductible is met. What happens is Medicare now contracts with doctors, hospitals, and facilities, providers, and you pay the Medicare negotiated rate until the deductible is met under original Medicare guidelines. It's really simple. So the bottom line on Medicare Advantage plans with prescription drug coverage versus a high deductible G, they're both great options. Every person is different and everybody has a different risk appetite. I don't like the stereotypes of who should get what plan. You should be aware of all the options and hopefully make a decision that fits your needs best. Both plans have a maximum out of pocket, so this is an important note. So you will have a maximum exposure annually. So if you went with the high deductible G plan, you would have a $2,490 deductible in 2022, and then the only other cost would be your premium for your monthly plan. And then if you go with the Medicare Advantage with prescription drug coverage, Their max out of pocket varies. I've seen it as low as $2,500 in certain areas, and in Cincinnati, where I live, it's an average of $4,900. So you will get a variation on these plans anywhere from $2,500 up to $7,500 plus. Advantage plans in this discussion include prescription drug coverage, as I mentioned. If you go with a Medicare Supplement plan, they never include a prescription plan. So you must purchase a separate standalone prescription drug plan. Medicare Advantage plans have a service area, and plans will vary by state, county, and zip code, like I just mentioned. You could literally move from one county over in your area, and it could possibly be a different service area requiring you to switch plans. Medicare Supplement plans, on the other hand, are standardized. If you buy a high deductible G plan in Ohio, it will be the exact same plan if you were in Arizona. So all you would need to do is change your address. Now we're going to go into some of the pros of Medicare Advantage plans with prescription drug coverage. So here are the many pros that you get with a Medicare Advantage plan with prescription drug. If you watched TV last year during the annual election period, which is 10/15 through 12/7, I will mention that in a second. But if you watched TV during that time, you probably saw J.J. Walker from Fast Times, Dynamite, or our buddy Joe Namath from the New York Jets. They were promoting these plans. Just enter your zip code. The zip code determines the service area that I mentioned in the previous slides. What's nice about Medicare Advantage plans, or many of them, is there are zero premium plans. You literally pay nothing for the plan. You do continue to pay Social Security, that $170.10 I mentioned a few slides ago, but other than that, these are a zero premium plan. And what's really nice is they include a lot of these extra benefits that I'll go over. A gym membership, dental, vision, and hearing coverage, transportation that may include 12 to 60 one-way trips a year, over-the-counter allowance for non-prescription items like aspirin, Band-Aids, Depends, toothpaste. They'll give you a catalog, and you'll get $50 to $75 a quarter possibly to get these non-prescription items. You might get meals. So let's say you're discharged from the hospital. They might give you 14 meals over a 7-day period. You could get the personal response system, going back way far back in TV commercials. I've fallen and I can't get up. That's what the personal response system is. You might get a 24/7 nurse line. There's lots of value-added benefits to the prescription or to the Medicare Advantage plan with prescription drug coverage. And the last thing that's really nice about these plans, there's an annual election period that runs October 15th through December 7th. And you can change this plan for no reason whatsoever. You do not have to go through any type of underwriting. You simply will do a new review, and if there's a better plan that suits your needs, maybe a prescription changed, maybe your doctor dropped out of the plan, during this period, you can switch plans, no questions asked. You cannot switch a Medicare Supplement necessarily without going through underwriting. Most of the time, you have to go through underwriting with a Medicare Supplement. So let's jump on over to the cons of a Medicare Advantage plan. So let's talk about a few of the Medicare Advantage with prescription drug coverage cons. There's a max out of pocket, and it can vary by the plan and service area that I've mentioned in a few of the other slides. So in Cincinnati, I'd say the average is about $4,900 max out of pocket. Comparing that real quick to high deductible G deductible of $2,490 plus a premium of about $35 for a male aging into Medicare at age 65. On that plan, they'd be out about $3,000 versus $4,900. Either way, either plan, it's going to take a pretty bad year, unfortunately. So it's hard to hit that max out of pocket. But if you did, you'd be out a lot more with a Medicare Advantage plan than you would a Medicare Supplement. You must use doctors, hospitals, and pharmacies in network. I'm going to talk about HMO and PPO plans only right now. There are private fee-for-service plans and Medicare Advantage plans with a medical savings account as another option. If you're interested in learning about those, we would go over them before you made a decision. So you must use doctors and hospitals in a network, whether it's an HMO or a PPO. If you go to an HMO doctor and you go out of network for anything other than an emergency, it's not going to get paid. If you go with a PPO plan, you'll have coverage out of network, but you will have a higher out-of-pocket cost. And then with pharmacies, whether it's a standalone drug plan or a drug plan built into the Medicare Advantage plan. There's a preferred network, a standard network, and then there might be an out-of-network. So going into what that means, you could have a different cost going to Walgreens versus CVS. So it's important that we look at both of those options as when you're getting a drug plan. And then other things to consider, there are narrower networks even for skilled nursing facilities and specialists. Not all specialists, there's tons of cardiologists, orthopedic surgeons, but if you have a really big concern for like neurosurgeons or something like that, you're not going to have nearly the network that you would with original Medicare and a Medicare supplement. So just something to consider. If we go into an Advantage plan discussion, I would like to know if there's a skilled nursing facility that you must have as well as your primary care doctor in your hospital. Very rarely is that discussed, so it's an important thing to be aware of. And then the co-pays for those can be pretty high. So if you go to a hospital or a skilled nursing facility, after days 1 through 20, skilled nursing care covers up to 100. Days 21 to 100 can get pretty pricey. After day 100, it doesn't matter what plan you have, it's no longer covered. That's why people get long-term care insurance. And then the last thing to be concerned about a little bit, a doctor or hospital can drop out of a plan at any time. It's rare, but it can happen. So here are a few of the pros of Medicare Supplement High Deductible G. I love this plan. This is my favorite plan. But again, as I've told you, it's not for everybody. All right. So here are a few of the pros. What I like about any Medicare Supplement plan, whether it's this one or another one, is you can go to any doctor, hospital, or facility that accepts Medicare. As long as they accept Medicare assignment, you're good to go with this plan. So if original Medicare covers something, this plan is going to pick up the gap. And remember, I told you there might be a skilled nursing facility or a highly specialized specialist that you need to see. You don't have to worry about it with this plan as long as they accept Medicare. These are the lowest premium plans. They start anywhere from $25. I've seen them as much as $61. Again, that will depend on where you live. And then what I really like is Medicare pays first, as I've mentioned in the past, and they negotiate very well. The high deductible G in 2022 is $2,490. That is a lower out-of-pocket cost than almost all Medicare Advantage plans. $2,490 plus your premium. That's what your worst case scenario is going to be with one of these plans if you have a really bad year. What I also like about these plans, it's a healthy pool of Medicare beneficiaries. So if you're really healthy, this plan is for you. If you're really unhealthy, this plan is not for you. All right, and we can discuss that. And then you can switch plans anytime, but there is a con to this as well, and I'll go over it in the next slide. So here are a few of the Medicare Supplement High Deductible G cons. There are better supplement plans if you're in poor health, and we can discuss those. Prescription plan is not included, as I mentioned. This plan does not include the value add-ons Medicare Advantage plans include, like the gym membership, dental, vision, so you would have to pay for those out of pocket. And then if you ever want to switch plans, I told you this was a pro in the previous slide. Well, there is a negative to it. You will have to answer health questions if you want to switch after your initial election period. So you have a 6-month window where there are no questions asked when you're originally given Medicare, and then after that, they can ask health questions. So if you have pre-existing conditions that prevent you from getting a plan, you could be denied, and that's a negative of these plans. All right, we made it to the last slide here, and here are a few of my thoughts and things to consider when you're comparing a Medicare Advantage plan with prescription drugs versus a high deductible G. Both are great options based on your risk appetite. As I've mentioned from the very beginning, everybody's different. It doesn't matter if you're a millionaire or you're making $20,000 a year in retirement. Both plans can be the right plan for you based off of your appetite. Just giving you a little bit of transparency, I make the least amount of money on high deductible G. Personally, it's my favorite plan of all the Medicare Supplement and Medicare Advantage plans out there. I just think it's the perfect happy medium between all the plans. However, I make the most money on a Medicare Advantage plan with prescription drug coverage. So think about it. I make a percentage of this plan, and in Cincinnati, it's $35 premium. So even if I'm making 20%, which I don't even think I make 20%, I honestly don't know what my commissions are. I don't look at it. I've never sold a plan based off of commissions. So whatever my commission is on $34 is way less than a Medicare Advantage plan. Just being transparent with you. They're both great plans, and I don't care which one you go with. You're going to make an educated decision, and that's what's most important to me. You could save a lot of money with either of these two plans if you're really healthy. You can have a 0 premium, or you can have a $34 premium. You can have a max out of pocket with high deductible G of $24.90, and then just depends on the Medicare Advantage plan where you live. So the out of pocket maximums are what you really need to consider when you're making a decision and what you're comfortable with. And then I do like the flexibility of being able to go to any doctor or hospital with Medicare supplements, but the plans have great networks, whether you're with an Advantage plan or, open network with the Medicare supplement. And then last, Medicare Advantage plans include the prescription drug coverage. The standalone plans you must get with a Medicare supplement plan. If you do not get one, there is risk of penalty, and we can discuss that if you're really healthy and you don't take any meds. A lot of times people don't want to get a prescription drug plan, but if they understand the penalty, it just makes sense to get the least expensive plan, and that will make more sense if we discuss this. And then one other important note about prescription drug plans: whether you have an Advantage plan or a standalone plan, the structure is identical, and we would go into the structure of those plans if we work together. So I hope you found this information useful. Again, both are great plans, and I just like to inform people on keeping money in their pocket versus giving their money away. That's kind of my tagline here: protecting your health and your wealth without putting you at a whole lot of risk. So I hope you have a great day. Again, my name is Chris Ruhm. You can come to chrisruhm.com and find more information about Medicare, my blogs, get a quote. At the bottom of every page of my website is a contact form, in addition to my phone number being 513-335-2465. Have a great day, and thanks for watching.